Hello, everybody. This is Laura from Healthy Carnivore. Just checking in with you guys. Going to go over Sjogren's tonight. That was something that a viewer reached out and wanted me to kind of go over so that they could kind of understand it a little bit better and some of the day to day things that they could do to try to help alleviate the symptoms of Sjogren's. So, I'm going to give a little background about myself. So, I am a registered nurse. I've been a nurse over 23 years. Started out, I was a heavy kid, and by the time I found the end of high school, I was 240 pounds. Following my new physician, um, who was only a couple years out of medical school, following his advice, I quickly ended up at 313 pounds, and that was following a very low fat, like chicken, no skin, no fat. The salad dressings that are um, low fat, which means high sugar. So I did a lot of that. Doritos were actually on the diet, okay? So those are considered vegetarian. So I did the things that he had said. I wasn't really super active. I mean, I was young, but I wasn't super active. Um, and like I said, I got to 313 pounds. They drew my blood. You actually could see it looked like pieces of Crisco in it, which was actually triglycerides, which I know that now. And my labs were off the chart. My triglycerides were at least 1,000. That's as high as their monitor went, but it went there in like no time at all. Normally they have to run it a little longer. So who knows how high it actually really was. My total cholesterol, I don't remember what it was. I'd have to dig out my paperwork. I think the majority of it was all, yeah, it was pretty crazy. But I'm not afraid of cholesterol. So anyway, triglycerides, yes. Cholesterol, no, especially LDL, not afraid at all. I don't have fractionated little broken cells of that. So particles of that. So I'm not worried about that. That is a concern for some people. But anyway, so um, I went to see him after I got up to the 313 pounds. And of course, the first thing he did was he wrote a script for Lipitor. And I mean, I was young. I wasn't a nurse. I just, thought of it like an antibiotic. And I remember asking him when he handed me that paper, how long do I have to take this? I'm thinking 7, 10 days, like you do an antibiotic. And he was like, forever. And I was like, I am not living out of a bottle. I'm like, I am 20. I think I was just getting ready to turn 20. I'm like, I'm not living out of a bottle. And he's like, well, you're going to have to. He goes, you're going to be diabetic. You're going to be poking yourself 4 times a day, checking blood sugars, and you'll probably be on insulin by this next year. And I was just like, the hell I am, because I hate needles. That's why I poke other people. I don't poke myself if I don't have to. Once in a while, I'll do the keto mojo, but not very often. And so basically, I just was like, this sounds like total horseshit. And I've always been a questioning type person. Like, I don't just take something at face value generally. Um, like everything gets an even amount, and you can either build on that or take away from that. And so I went to the library every single night after work for several weeks, made copies of all the old medical journals and veterinarian books I could get my hands on. They were all between 1850 and 1910, because that's before the medical system got hijacked. So I basically just read and read and read. And before, I didn't used to have really good comprehension with reading, but when it's something you really, really are interested in, I did. I just like a sponge. I took it all in. So I never filled the prescription. I went and cleaned out my pantry, got rid of everything white, just basically ate fish, deer, and beef, some pork, some chicken, at the time, and then a few of the vegetables. We always had a garden, so everything was, I knew kind of where it came from. I knew what it was, mostly fed, and did that for 26 years. Perfect. I dropped 153 pounds in 9 months. Went back to see him, had my blood work done, a few days before going. This time, when they turned it on the side and had me read my name and birthday, there was no little fat globules in there. And so I knew that had to be a good sign. And so when I went to see him, of course, he walks in very arrogant, very arrogant. And he was like, patting himself on the back of, oh, Lipitor. Well, first of all, Lipitor does nothing to triglycerides at all. It does break down and ruin your LDL, but it does nothing to triglycerides, nor does it help you lose weight. Um, but he was just like, "Oh," and I was like, and I just let him, like, live in that for a minute, and then I just said, "I did not fill your prescription," and I pulled it out of my purse and handed it back to him. He was extremely pissed. He sat back in the chair, um, and was just, like, beside himself that I had not done what he had told me, and that I had done, and I said, I changed what I was eating. I changed what I put in my mouth. I changed the fuel for my body, and that has to make a difference. And he literally said, what you put in your mouth has nothing to do with your body. And I'm like, you see my car sitting out there? It's got a 327 out of a 68 Corvette. I rebuilt that, souped it up, and I have to run turbo blue. I can't run low octane crappy fuel in that, or it runs like shit. I kinda have to believe that our bodies are the same way, that if you put good stuff in, you get good stuff out. And he was like, "Absolutely, blah, blah, blah." I don't even remember the last of what he said because literally I was so mad. It was just like ringing in the ears. And I fired him. And I told him how disappointed I was in him that he, coming out of medical school, being out of school for 2 years, didn't know how the body worked, and I had went and had to do that myself, the old-fashioned way, papers and booklets and stuff and go through all the medical journals, um, and so that's kinda how I got to where I was. I went to RN school, after being keto for several years, so I kinda knew some of what they were teaching. I was like, "That is not true, that is not true," but I kept it close. I remembered it for the test, and I got 100% all the time. I had a 4.0 in there, um, because I can memorize whatever they want. Doesn't mean that's the truth, doesn't mean that's what I'm gonna do. So, that's what I did. Like I said, I did keto for a total of 28 years. The first 26 were very clean, did well. Had trouble with, milk products, but I always did even as a kid. It always caused me to make tons of mucus. I had lots of sinus pressure and swelling and inflammation. Um, and I got into the keto treats that came out because, as soon as the food industry sees it, oh, this isn't just a fad, that this keto is really kind of out there and about, then of course they want to make money off of us. So then it was the keto treats. And my gut could not tolerate the amount of like maltodextrin, the amount of like cornstarch, the amount of all the different types of sweeteners that were in those foods, and destroyed my gut. And I mean, I had cystic acne super bad. I had anxiety and depression really bad. I still have a little OCD and I plan on keeping some of it. But it was off the charts. It was like shampooing carpets at 2 in the morning. My poor husband. I did it a lot. Um, anyway, so just happened to be scrolling one night, and this Joe Rogan guy comes across my reels talking to this big ox of a dude, which ended up being Dr. Sean Baker. And it was intriguing. So I just kept listening. And, those are long. I mean, that podcast, I don't think was a 3 hour. I do think it was like an hour and something, the first time he went on. And then, of course, he's been on again since then. But I was just like, "Oh, this sounds like me. This sounds like what I need to try because I need to get all that crap, like the plant oxalates and the lectin, all that stuff." I was like, "That makes sense," because when I would eat a ton of vegetables, it did the opposite of what they want fiber to do. It did not help me whatsoever. So I was like, "I'm doing it." And I started it the very next morning. In fact, last month was my 7-year carniversary. Um, and, I have done all the different kinds. I've done the protein modified sparing fast. I've done the high fat, moderate protein. I've done different kinds of fast. I mean, I've been through all of the stuff. And where I found for myself is the lion diet with eggs added. And not every day, but I do some eggs. But the lion diet, which is ruminant animal, and I found that that seems to work the best for me. I have done the occasional fermented pickle or fermented cabbage and carrots, like a bite of it or a drink of just the broth or the juice that comes off of that for like resetting gut and stuff. Um, but I really feel my best at that. Now, that is not saying that every human being out there needs to be carnivore. I do think at the beginning, when we're trying to clean out and get rid of a lot of things and do the most amount of healing, I really think that that is the most important thing to do, is to be carnivore, which is all the different animal products. It's not just ruminant meat like I do. And then once you hit your healing and healing a lot of the things that you're doing, is to then come in and start adding a thing like a food group, like a milk. If you like milk and you're dying for milk, put some milks back in, see how you react in a week. If that's been fine, then add, if you're like, I really love cabbage, not me. I did that stupid cabbage soup diet back in the day. That is abuse. Anyway, um, but you can try to add things back in. And, I think had I not done the keto treats, maybe I could have stayed keto for that time. But I absolutely enjoy what I'm doing, the way I eat. It is the simplest for me. I don't think about anything. I don't have to weigh things out. I don't have to have all these crazy ass ingredients. I just don't. And that's what I like. I like to have time to do these kinds of things. I like time to do my research. I like time to make my blankets for patients. I like to make my products. So that's kind of where I am. So now that you know pretty much everything about me, let's go over tonight's topic. But let's see who is here. Let's see. Hey, Sandy, how are you? Happy Monday, T. Let's see. Oh, hey, finally caught you live. Exactly. You did catch me live. That's awesome. And Tara, good to see you too. Let's see. Lambs is here. Hello. Sharon, hello. And Marla, hi. Good to see you too. Jason is in. Let's see. I bet that doctor was metabolically unhealthy. So, funny you should say that. So, probably on the inside. But when he first started talking to me about my diet, I mean, he's 6'5", 6'7". I mean, he's tall, very tall. And he was actually a beanpole at the time. When I got to take care of him on the open heart floor many years later, he was almost 500 pounds. So he had been on his statin since 1989. They came out in 87. He was diabetic. I mean, he had all the things, kidney disease. I mean, he was a wreck. Um, so, yes, karma is a beautiful thing. Let's see, just in time. Oh, yeah. Oh, hey, Kat. You did make it. That's good. Let's see. Yes, thank you for the happy carniversary. Did Laura? Thanks. Thanks, Lambs. Hello, Laura. Live from my job, listening to you. Oh, I'm glad you're listening. Hopefully, I don't make you do anything too crazy. Sometimes I make people laugh. I don't really mean to, but sometimes I do. Hey, Cheryl, how are you? And Erica, hey, how are you? So let's see. Sometimes one gets to see karma, and yes, not every time, but in my life, I've been pretty fortunate that I have gotten to see that. So many times, many times. So I never wish bad karma on anybody. I have been known to say, may you have the day you deserve. And I have said to people, may you get the karma that you deserve, because I think there's good karma and there's the kind you deserve. Um, so anyway, let's go over tonight's talk. Like I said, this came to me from somebody who watches my videos and wanted me to go over that. So I'm going to go over it with you guys. So it's spelled really crazy for it to be called Sjogren's. It is Sjogrens apostrophe S. So it's just pronounced Sjogren's. I don't know why it's spelled that way. Maybe that was the doctor's name. Who knows? So it is an autoimmune condition. So basically, that just means your immune system starts attacking your own moisture producing glands. So what a lot of people will notice is dry, super dry mouth, dry eyes, horrible, like massive, like if anybody out there's ever welded and got flash burn, it is a sandy, dry, like the pits of hell are in your eyeballs kind of feel. That's how they kind of describe it. I have a patient right now who had a bone marrow transplant and has graft versus host. And Sjogren's, that's what happens. I mean, the eyes is just horrible in the mouth. It's crazy. So, mostly, like we said, it's mostly the tear glands and the salivatory glands, but it can also go further than that. So, it can affect your esophagus. It can affect your gastric, like your stomach itself. So yeah, there's a lot of people that have this that end up with feeding tubes. So it's not uncommon to see that. Not a good outcome. That's not something you want to have long term forever. You also might notice, and this is something that people usually that I've worked with will notice these things before they even have like the severe enough dry eye or dry mouth that pulls them to a doctor. They'll talk about these things. So, like joint pain and stiffness, excuse me, fatigue that is like there's nothing you can do to get rid of it. You can sleep, get up, and it's going to just be like you never slept. Fatigue that is like life altering fatigue. Swollen glands, especially up here around the jaw, dry skin, vaginal dryness, nasal dryness, and brain fog, which, granted, these can be with a lot of different things. But if I have somebody who tells me these things, and you usually have all of those, unless you don't have a vagina, you only have vaginal dryness if you have a vagina. But the rest of them, pretty much everybody I've ever had every one of these. So it's one of those where if they start talking that, it's like, oh, we need some testing. I think this is probably what it is. Um, so now that we kind of know that, usually this is what they say, but they couldn't back this up. So I'm going to say it, but I'm going to tell you, I couldn't find any evidence of this. They say that it is usually a combination of genetics. I could not find anything, including a patient that I currently have, literally a patient I have in home health. There's zero genetics. So environmental triggers, viral infections, toxins, and even hormonal changes can lead to this. It's really common to see Sjogren's show up alongside other autoimmune disorders. So, like rheumatoid arthritis, lupus, even eczema, psoriasis, sometimes people will progress and get worse. If you're wondering how to test for it, the doctors will usually check an ANA. So, that's an anti nuclear antibody test, or an anti SSA or anti SSB. Those are really big markers that will show if it is for sure Sjogren's. Okay, they have got it down to the wire. They know what it to look for. Rheumatoid factor, and sometimes they'll do the Schirmer's tear test or even a lip biopsy. Um, can you imagine? I can't even imagine having to do a lip biopsy. I'd be like, here, can you just take a tear? I would rather you do that because I've never seen somebody that had the the dry mouth that didn't have the dry eye ever, ever, ever. Maybe they can't make a tear to be tasted, but still, or tested. Tasted, that's gross. Anyway, so when it comes to like eating style, I'm not a fan of the medication side that they've done for a lot of these people, um, because it's shutting down their immune system. And when you take things that totally shut it down, and I'm not saying there aren't times where you've had such a really severe outbreak of it that you have to kind of go that route. Maybe you do. I don't know. It's not what I would personally do, but who knows, Um, but those medications, like I said, every one of them out there, they're usually monoclonal antibodies and different things like that. They call them MABs. Those are like cancer medications that they have found also can work for some of these things. And when I say work, I mean they treat the symptoms, they don't really fix it. They don't go after the root cause, which is more of like what I like to talk about. So, from what I have seen, what I have experienced, that the way people eat could absolutely improve this. Okay. Because if you're eating very, very low carb, and even if you're doing keto and you're doing like the 50 grams of carbs a day, as long as you're getting into ketosis, you're going to decrease your inflammation. And that's the most important thing. Okay. Um, So it helps reduce the inflammation. It can calm the immune system, like let it chill out. It can kind of help allow that gut lining to heal, especially if you're not doing high oxalate vegetables that really can kind of tear up the gut and the intestines on the way out. Um, it is a really big piece of autoimmunity is the gut. So that is where I would do everything I could to try to fix the gut. It's a single cell organism. That thickness is single cell thick before it can permeate out into your body. So it is very, very, very thin. And just think of all the acid that's inside there, but it's supposed to be there. Okay. It's not supposed to work its way out. Food particles that are not broke down are not supposed to work their way out either. So cutting out processed carbs especially, but all processed foods, and I don't mean like you got meat and you cooked it. Of course, that's a little processed. I'm talking about if it came out of a box, out of a bag, and it has a warning label. No, wait, I mean a nutrition label, which is usually a warning label. Um, that's what I would cut out. I really would, even if you have to eat just simple one ingredient foods. I mean, that's what I would do. I would cut out the seed oils, and that's like your canola, your grapeseed, your corn, like your Wesson and stuff like that. Those oils I would avoid. I would do butter, I would do ghee, I would do tallow, I would do lard, um, and I would do olive oil and avocado oil. Those are made from the fruits. They are not made from the seed of that thing. So anyway, that's what I would do. I would also avoid sugars because sugars cause the inflammation. So if you're swelling up a lot of these areas, you're going to have trouble getting the fluids and the glands to work. Even if the glands are working, they can't get this stuff moved on because that tract is inflamed. Okay. Um, so these things can make a world of difference for how these people feel day to day. Many people go strict carnivore or very clean keto and they see much less fatigue. They see much better like joint mobility, less pain in their joints, improved dryness and symptoms over time, especially my favorite, very high fat carnivore, and that's where I mean 80% of your calories, if you want to count them, are going to be from a fat, and then 20% is going to be protein. Because, and I've noticed this like last week, I I had fat, but I didn't have it all cut up and froze. I just had like the big block of it froze. And I was like, crap. And I was like, I'll just eat the fatty hamburger for a few days and that won't be such a big deal because I mix it very heavy and my hands got so dry, my hair got super dry where, like, if I'd take my coat off at a patient's house, I mean, my hair just, like, stuck out, it was crazy, and I was like, "Yeah, I need to get that cut out." So, that's what I'll be doing after I get done here, is I will be cutting up a whole bunch of my ribeye fat and putting it away in, like, my, 1-pound bags. So, if you are struggling with really any autoimmune condition, but especially Sjogren's, I would start by just cleaning up your diet and supporting your body naturally. So, hopefully, that kind of gives you a little information as to what it is and what I would recommend. I am not a physician, I am a nurse. So, this is not medical advice. This is what I have seen work, and it is what the literature that I was able to find that I trust. I go to multiple areas to look up different things. And I had found something back in like 1974 was the first thing I really could find on Sjogren. So it's a newer thing. And how come we didn't have it before? I know people are always like, oh, they didn't know better. They didn't look at, yes, they did. The words that they had in these books that were from 1850, yes, they did. They knew. Okay, free thinker. Hey, good seeing you. Let's see. Breezy's here. Hey. And Simpson. Hey, it's good to see you too. So next week is another item that was asked if I could go over that. And so next week I'm going to go over lupus and what it is and the things that can happen with it. So this is I never, and I don't know, maybe you guys do. I know of nobody when I was growing up that had lupus, Sjogren's, and I was born in 71, but I don't remember anything like that. And I was up at the University of Iowa a lot. So a lot of people came from all over the country, outside of the country to there. And so there was things that I saw there that you didn't see out in the average doctor's office. You weren't going to bump into it with somebody at church. Um, but I don't remember ever seeing any of this stuff, this autoimmunity. I mean, we did have David, the boy in the bubble, but he was born without an immune system. He was up there, and that's the only thing I know of anybody, that had that like an immune problem. So it was just odd. Um, so let's see. I think that's it. Unless I got the collagen powder and the MCT oil you showed last week and have been including it in my morning coffee. Don't even taste either. Yeah, you can't really taste those. They really don't have any flavor, chow. So I I put it in there all the time. So let's see. Sjogren's is likely Swedish spell. Yeah. Yep. I think you're probably right. Yeah, I never could pronounce her name. That I was like that singer. I was always like, "How do you say that name?" And I still really don't know how. I'd be lying if I said I did. Um, so yeah, I'm gonna get off and I'm gonna go cut up the fat so that my hair straightens out and my hands quit being so dry and I'll have a little bit better energy. I ran this morning and I was like, I don't have quite the energy I normally do, but I'm used to doing really, really high fat. And, the last few days it was not what I would call low fat, but it was probably 50-50, and that is not for me. So I'm going to go back to the 80-20 where I feel my best for sure. So anyway, I do appreciate you guys being here tonight. If you like this, please hit the like button, share it out if there's somebody that has Sjogren's or you think that they may possibly have that. Um, yeah, and then subscribe and hit the notification bell. Sometimes it lets people know that I'm going live, and sometimes it does not. Um, I'm not sure why. So I have a daughter and granddaughter with common variable immune deficiency. Oh, interesting. And did they say that that was like a mismatch on their DNA? Are they missing something? Um, it would make me wonder if they didn't have like a fold, because there are a few of those things that can. It's B York. Thank you, Kat. Let's see. T says, "Hey Laura, I am simmering some brisket. Ooh, right now for the tallow. Yum. That sounds really good." And I made tallow this weekend. I had a bunch that I had cooked up, like, and ran off from different stuff of fat. And so I rendered it down and, put it in like a couple quart jars over the weekend. I should have left some of it out. So darn it. Um, oh, thank you. Much love to you too. And you're welcome, free thinker. Simpson says, "How much fat trimmings would you say you eat a day?" Ooh, half a pound. Half a pound. Pretty easily. Half a pound before I cook it. Of course, once you're done cooking it, it's nowhere near that. But I usually do one meal a day. And I do half a pound to about 6 ounces of whatever kind of meat. So that's what I do when I'm not doing, ran out of the stuff I had cut up. Bree says parts of the immune system that are missing and parts don't work. My daughter passed away. Oh, that is horrible. Um, do you know who Gary Brecka is, Breeze? I would wonder if it wouldn't be, I mean, it's a little bit expensive, but I would wonder if it wouldn't be a good idea to have some testing done, to see if there are some things that he could help assist. Um, there's some different kind of peptides that I heard him talking about with some of these things. So that might be something to look into. Gary Brecka. I think it's, let me look because I follow him on YouTube. I don't want to spell it wrong. I'm sure that's what it is, but we're going to look because I think the name of his podcast, it's Ultimate Human, is the name of his podcast. Ultimate Human Podcast. Let's see how he spells his name. Where is it? Brecka. So Gary Brecka is Brecka, and I think the name of his company is 10X, just 10X. And I would look to see if he wouldn't. Um, I would work with him because I think there are some things that they can do. That's what I would look for. Yeah. Yep. They give. Yeah. Yep. Gamma globulin. Yep. I just wonder if she wouldn't be somebody that would do well with um with having, like, some of these different peptides. And I'm not talking the peptides that lose weight. That's not the ones I'm talking about. Um which you don't really, the GLP ones are different. Let's see. Venetian cat. Do you do consultations? Yeah. Yeah. So if you go out to my website, which you can find in my description here, it's just Russell Brands with a Z, like Russell Brand, the comedian, .com. And up at the top, it has like Laura Lynn, which is my name. And I think it has like book with a nurse, or you can go to the very bottom of the page and it's like talk with a nurse or speak with a nurse or something. But there are options there if you want to do that. I do 15-minute and I do hour, which really turns into 1 hour and 2 hours, is generally what they run into. So I charge for the 15 minutes, and whatever it runs over to, it does. That's fine. Same with the hour. I've had one that was 3 hours. It was that needed. That's fine. I charge for the hour. I'm not in this to make a killing. I really am just in it to try to get people as healthy as possible. Um, so that's what I do. Let's see. I have followed Gary Bricka for a few years. Very fascinating. Yep, I agree. I do watch his Ultimate podcast, and he has so many different genetic type doctors on there, holistic doctors, a lot of different stuff. Because I think, with our genome, there's different things that we don't know. But I still would be high fat, low carb, no matter what. I don't think there's anything like, I can't get bit by that tick, because if I get alpha gal, I'm going to be the size of, what was that lady that was married to David Bowie? Twiggy, Ziggy, I don't know, whatever her name was. That's what I'll look like. It'll be horrible. I will be like 100 pounds. So we're going to stay away from ticks because I can't do it. So anyway, I appreciate you guys for being here. Hopefully, I got to all of your questions. As I always say, meet, heat, eat, and repeat. And I will see you guys next Monday. See ya.